is, what are we doing
Valgus
next?
stress.
Valgus stress.
And Varus stress.
Valgus and Varus stress test of the knee. We've already done valgus and Varus stress of the
Elbow.
elbow. And remember, when you're doing valgus stress, that means you're taking the distal part of that lower arm and you're moving it, you're abducting it, right?
Yeah.
Right? And that's, so when we're going to do, this valgus stress is a lot of the way I'm going to show you how to make an adjustment in here. So I'm going to have you do a very similar position. We're going to have to do something. They're not going to be able to see there. Y'all might have to stand up for a minute to see me working with Dr. Power here because these tables are all in the way. Okay. If you can't see, then please get a place where you can see. Okay, we'll talk about valgus stress. And when you're doing valgus stress, we're stressing the medial part of the knee. And the medial part of the knee, what we're testing primarily is the medial collateral ligament, right?
Mm-hmm.
And so, we're going to take the patient's leg like this, and I want you to bring it up underneath your armpit like this. And then I'm going to have you grab right up here on the patient's calf. Then as a fulcrum, you're going to put your hand right on the lateral side of the patient's knee. And I'm just sort of going to lean in like this with my body.
Mm-hmm.
Okay? And as I'm leaning in like this, I have this fulcrum here. And we're going to start it, let your leg be real relaxed. We're going to start it in complete extension. And then I'm going to move it up and do it again in about 20 or so degrees of knee flexion. Okay? So when you're doing it on the test, I want you to first start off with full extension and then back off and to maybe 20 or 30 degrees. What do I have on there? How many degrees?
30.
30. Yeah, I never measure it on the test. Somewhere in that vicinity, back off and then do it again. And what you're looking for there is pain, laxities, probably the biggest thing we're looking for when we're testing ligaments. Okay. Is there any laxity? Pain, of course, but laxity. So remember that. Tell us that on the test. Varus stress is the exact same thing except what? Yeah, opposite direction. So now what I'm going to do, still I'm grabbing it the same up underneath my arm. Everybody see that I have it here? And I'm going to pull the knee, or excuse me, I'm going to adduct the distal part of the leg while I have my forearm, my pisiform here as the fulcrum, causing stress on the lateral side of the leg, and that would be looking again for pain, laxity at the lateral collateral ligament.
Apple's distraction test.
Apple's distraction. These are all still reviewed? Oh.
No more.
Let me have you lay face down. So. What are we doing now?
Distraction.
Apple's distraction. What we're looking for here is we're looking for the collateral ligaments. Okay, distraction. And so we're going to do this by adding a little bit of torsion in there at the knee, and we're going to distract it like this. The only problem is when I do this, his whole leg comes up, his thigh and everything comes off the ground. His leg goes in, hip goes into extension. We don't want that. So you're going to have to put your knobby knee up here, which will probably cause your patient discomfort. I hate to say that. It probably will cause your patient
All
discomfort.
the tests.
And but discomfort here. So if the patient says that hurts, you better ask them where. They're going to say right underneath your knobby knee. You know. So what we're going to do here is we're going to distract, and after we distract, we're going to rotate. Okay. First, and the direction the heel goes is the collateral ligament we're doing. So this would be external rotation of the tibia, but the heel's going medially. So we're looking for the medial collateral ligament, okay? And then when you return it back to neutral, you should turn the foot back to neutral and let it back down. When you're doing lateral, pull this up, rotate the patient's foot. You're doing internal rotation, but you're checking the lateral collateral ligament. Remember, whichever way the heel goes is the ligament that you're testing. So everybody got that? Then turn it back to neutral and let it relax down. That's Apple's distraction for collateral ligaments. And I like to ask questions on the final. You know, tell me a couple of tests for the knee. Tell me what's positive, and I want different conditions. So I sometimes give a little case history. The patient has this, and then you're positive with this or with this. Roll this in, roll this out with your tests. Okay, because that's what you'll be doing in your office. Somebody has a knee problem. Is it meniscus? Is it collateral ligament? Is it anterior posterior cruciate ligament? Is it patella tracking problems? You know, you have to try to figure all these out, and your orthopedic test can help you to zero in a little bit on it. So I want you to be able to dance with these tests a little bit, okay? Not just the A plus B equals C, and that's all you know. You have to be able to throw them all into a bucket, mix them up, and pull some things out.
Apley's compression test.
Apley's compression. What do you think we're going to do here?
Push down.
We're going to push down. And again, whichever way we're pushing, now we're testing for meniscus. Now we're testing for meniscus. Now, if you've noticed, I'm not grabbing the foot when I'm doing this. Some people will grab the foot and do it. I think the best technique crosses fewer joints. So that's why I'm grabbing whenever I'm doing these just proximal to the ankle. Okay. So if I'm going to do compression, what I'm going to do here, I know your notes say that you're supposed to stabilize. I got those two things. I was mixing them around in your notes. There's no need to bring your knee up to stabilize the patient's thigh on this one. Okay. There is on the one previous. So this one, all I'm going to do is I'm going to come up over my patient like this, and I'm going to press down in. And after I press down in, I'm going to turn my foot. Okay. So I'm doing external rotation of the tibia. The knee is going, the heel is going which way? Medially. And so I'm testing, what do you think? Medial meniscus, right? Lateral meniscus that way. Okay? Bounce home test. This is one that we were talking about a little bit the other day. Who presented osteochondritis dissecans?
I did.
You did? This is one of those tests. Would you lay supine for a second? This is one of those tests that can be for osteochondritis dissecans or for meniscus. I'd rather think of it as meniscus because that's the way I was taught about it a long time ago. Some people say the other. But anyway you look at it, you're having a problem with the locking out of the knee. You're not getting full extension because either it's locked on the meniscus or you have some joint mice in there, which can be from the sloughing off of part of the bones because of that ABN process that's taking place, and then they break loose and they get stuck in the joint. Okay. Does everybody remember?
Yep.
We're on the discussion again. All right, so what I'm going to do, simply I'm going to grab onto the patient's ankle just like this, and I'm just going to gently lift this up off the table just like this, and I'm going to let it drop. And it should have a nice little locking point at the end there. And if it doesn't, and it doesn't fully extend, then something's blocking it. Osteochondritis dissecans, or maybe a meniscus problem.
McMurray's son?
McMurray's. Before we do McMurray's, let's do
Thessali's?
no,
Patellar
Wilson's. Is there a Wilson? The Wilson's is in there, right? Wilson's test is also for osteochondritis dissecans, so we'll sort of keep them together. And I know there's a bunch of meniscus, but there's only two for osteochondritis dissecans. And this Wilson's test is specifically for that. It doesn't have a high predictive value, but nonetheless, it's sort of like the only thing we've got. And as when you presented on osteochondritis dissecans, remember the femoral condyle that was involved? Which one was it? Do you remember? No, when we're on the knee, I'm sorry. I think it was the medial femoral condyle, right? So what we're going to do is we're going to take the patient's knee like this, and if you remember the picture, you remember your anatomy, and you look at these condyles. Here's your femur, comes down like this, right? And it's coming down, and then it goes sort of like this, you know? And then this is sitting like this, right? And you have this little protrusion sticking up. And then you have your dissecans happening in this area here. So this would be our left side of the patient's supine, right? So, so here's our patient. So what we're going to do is we're going to take our patient, we're going to put his knee all the way up like this. And by the way, a number of our tests start like this. And by McMurray starts like this. We're going to do McMurray's. Now what I'm going to do is I am going to turn my patient's foot. I'm going to do some internal tibial rotation, okay? And I think that's about all I'm doing. I don't add any valgus stress or anything on here, do I?
No.
And the patient actively now, while I'm turning this, the patient is actively going to straighten their knee and their hip. They're going to straighten it. When they get so far, it may cause them pain. And if it does, the concept is that this tubercle or this eminence, whatever you'd call it, is poking into the condyle. And so what should happen if he does have that, then when I just release the foot and put it back to neutral here, because it's hurting him here, and I go like this, that should take that pressure off of that and it should feel better.
Cool.
Okay. And they're the only two that I know that we have for this kind of need. If we run into another one, I'm going to forgot that.
Make me ready?
Okay, these are all new. Why don't you practice some of these? How many did we do?
21.
A lot. What's that? 20, but I mean of the new ones. How many of the new ones have we done? 6. Let's practice. And then you can review some of the other ones. Okay?